Hello, my name's Ann Dabra Woods, and I'm the Chief Nurse of Walters Clore Health Learning Research and Practice, but I'm also an acute care nurse practitioner at Penn Medicine Chester County Hospital, as well as adjunct faculty for Drexel University. And here with me today is Lisa Bonzel, and she's a nurse practitioner as well as our senior clinical editor for Nursing Center. So thanks for joining me, Lisa. Today we're going to talk about the MS patient and what they need when they go into the hospital, especially into the emergency room. Lisa, when we get a patient, and you and I have lots of experience with this, but when we get a patient who comes in with a chronic illness into the emergency department, what are the things that we as nurses and nurse practitioners need to know from them? What do they need to come prepared with?
So anyone with a chronic illness really needs to be able to tell us what medications they're taking, whether it's a printed list or the actual bag of medications and the bottles with the doses. We need the specifics. We need to know if they're allergic to anything. We also need to know who is their decision maker, who is their next of kin, and we need to know about their current illness. And I think you can speak to that, Anne, about how important it is that we know who's managing that illness and what the plan of care is.
That's right. So one of the most important things an MS patient can do is recognize that the people they're meeting in the emergency department, we are not specialists in MS by any stretch of imagination. We do know how to take care of you, though, but it really helps us to bring what you just said, a list of medications, or bring the bottles in with us, as well as your plan of care. If you have a plan of care that you're on, we need to know what that is, because the thing that we don't want to see happen is an interruption in your plan of care when it doesn't have to be interrupted. Certainly knowing who is handling your MS, who's your neurologist, who is your nurse care coordinator, who's ever helping to manage you, so that we can reach out to them right away. I certainly, when I get a patient through the emergency room that gets admitted to critical care, one of the first things I do is reach out to that primary care provider, the physician, the neurologist who's caring for the patient, to talk to them about how this patient's been doing, letting them know what's going on from my end, and then exactly what meds am I permitted to prescribe for that patient that's not going to interfere with their MS. So Lisa, what else do you think we need to offer this patient, or would be important for them to tell us?
I think we also need to know what their expectations are. So, they came into the emergency room. Is it an exacerbation of their MS, or is there something else going on that could or could not be impacted by their MS diagnosis? So we need to know what are their expectations, what are their goals, and really kind of try to make that transition from being an outpatient with a chronic illness to an inpatient with, an exacerbation or some emergency going on that, brought them in. Like, what brought them there, and what are their goals for being there?
I think, too, it was really our discussion with patients, and I know you and I have both done this. We say to patients, you know your body better than anyone. You need to tell us when you're having a change or you're not quite feeling right. That open communication between the patient as well as the nurse practitioner, physician who's caring for you is so vitally important, so that we can keep you on the right track with your MS therapy. Well, Lisa, thank you very much for joining me today, and all of you patients out there with MS, live wise.